Hi and welcome to our Conceived Baby discussion today. Today we're going to be talking about the impact of your diet on the most important and really amazing organ when it comes to fertility, and that's the uterus. We hear a lot these days in relation to fertility about egg health, which is obviously super important, but there's another important player, and that's your baby's first home. The place where this tiny fertilized egg will have the opportunity to thrive and grow into a healthy baby. The health of the uterus plays an important role in supporting implantation and supporting the health and development of this precious new life. So today we're going to be delving deeper into the role of the uterus, as well as ways to optimise uterine health through diet to improve your chances of conceiving and carrying your beautiful, healthy baby. So firstly, my name's Tasha Jennings. I'm a naturopath and nutritionist, and I help women and couples optimise fertility health to create healthy pregnancies and healthy babies through one-to-one consultations, professional presentations, programs, online resources, premium prenatal supplementation, as well as the Conceived Baby webinar and podcast series, which you are joining us through today. And the fabulous expert that I'm here with today is Dr. Jemma Evans. Gemma shares my passion in helping women achieve healthy pregnancies, and this starts before conception even occurs. She is a research scientist with a focus on understanding the endometrium, the inner lining of the uterus in which the embryo must implant. Her previous work has contributed to significant changes in IVF by characterising the endometrium in women during IVF cycles and demonstrating that in most cases a hostile local environment is presented to the embryo. This has led to a significant increase in the number of frozen embryo transfer cycles being undertaken. Her current area of research aims to improve the local environment within the uterus to provide an optimal home for the baby by intervening well before conception. She has identified a toxic inflammatory environment within the uterus which appears to compromise endometrial quality, embryo implantation, and development of the placenta. Now, Gemma is about to embark on a clinical trial to determine if a simple dietary intervention can improve the local uterine environment, leading to improved fertility and pregnancy health. And she hopes this will also improve the long-term health of the child, as the environment within the uterus can determine if the child will develop health disorders later in life, such as diabetes and obesity. And I love her mantra, which is healthy uterus, healthy pregnancy, healthy life. So welcome, Gemma.
Thank you very, very, very much. To anybody who can't see me, I apologise, but we're having some camera issues at the moment.
We are, and we can absolutely hear you quite fine, but we are far more passionate about fertility health than we are good at technology, I think. So hopefully you can all bear with us today. So thanks for taking the time out of your very busy schedule to be with us today. I know I've chatted with you off air and really excited about this discussion that we're going to have because it's really fascinating research you're doing. So, I mean, first of all, tell us a bit about your journey and what brought you to be so passionate about uterine health.
Yeah, well, I was never actually supposed to work in endometrial receptivity and fertility. So my initial undergraduate studies at university were actually in toxicology and finding out how drugs work, how poisons work, and how they influence our body. And that's actually where I thought I was going to stay. I thought I was going to be involved in clinical trials and decided to undertake a PhD to actually progress my scientific learning. That was supposed to be in endometrial cancer. And within a very short amount of time, I proved that the factors I was looking at during my PhD studies had nothing whatsoever to do with endometrial cancer, but appeared to be very important in endometrial receptivity. So that led me on to trying to understand more about the lining of the uterus, the endometrium, and how that changes and the factors that are involved in the critical changes for endometrial receptivity. And what I discovered during my journey through my PhD studies is that the endometrium is one of the most complex and dynamic tissues in the body. So unlike the heart or the liver, which is relatively static, although it has obviously lots of functions, the endometrium changes every single day of the menstrual cycle, which makes it a really difficult tissue to actually study. But I'm not afraid of an uphill battle. It was one of those things where trying to understand the dynamics of this tissue was really, really fascinating to me. So, culmination of my PhD studies, I characterized a variety of factors which appear to be critical in the human endometrium for characterizing the readiness or receptivity of that endometrial layer for implantation of an embryo. And then decided that this was where my big love was. This was my passion in the world, is actually trying to help women become pregnant more effectively. So I traveled then to Australia from snowy and often cold Edinburgh to work with one of the world's foremost experts in endometrial receptivity, Professor Lois Salmonson. And she has an incredible journey, and she's an incredible mind in the field of endometrial research, and particularly endometrial receptivity. And we've just exploded in terms of our excitement, and basically performing studies in the laboratory to try and underpin understanding of how the endometrium becomes ready or receptive for an embryo. So that's our big love, our joint big love, which I'm continuing on.
Yeah, I know I was with you recently at her symposium, which was really fascinating, and you really are on the cutting edge of the research into this area, which is really exciting. And I'm glad you came over to the side of fertility, because you're doing amazing research, and we're very grateful to have you here.
Thank you.
So I guess you've mentioned a little bit about the uterine lining and the uterus itself. Can you explain a little bit more? I guess, the focus is a lot on egg quality, and we hear a lot about egg quality, but the uterus, obviously, as I said, plays a huge role. Can you explain a bit about the role it plays in conception and the eventuation of a pregnancy?
Yeah, well, I guess there's two different aspects to consider when we think about the readiness of the uterus for implantation. So within the uterine cavity, so that's the middle bit essentially of the uterus, or the middle bit of the womb, we have an area which contains what we call uterine fluid. And that is a combination of various factors which have been released from the endometrium, which can enter into this communication with the embryo to facilitate its readiness for implantation into the uterine tissue, into the endometrium. So that the constituents of that fluid environment within the uterine cavity are really important, not just for that sort of communication, but also for what we call the final programming of the embryo. So that environment within the uterine cavity is really important for the final developmental steps of the embryo before it actually physically implants into the uterus. Now, the other part of the equation is obviously the tissue itself, and the readiness of that tissue for the implantation of the embryo. So the endometrial lining has to be adhesive. It has to be ready to accept the embryo in terms of getting it to stick to the endometrium, but it also has to be appropriately ready to allow placental development. So the invasion of that embryo into the endometrial layer to achieve appropriate formation of a placenta. There are various cell types that are involved in these processes. So for the adhesion of the embryo to the endometrium, we have to look at epithelial cells, which are the very uppermost layer of the endometrium. These are the cells to which the embryo has to adhere or stick to achieve the very, very first stages of implantation. We also have to consider stromal cells of the endometrium, which undergo a very highly specialized process called decidualization, whereby they transform from being relatively innocuous cells to being very highly active cells in the implantation process under the influence of estrogen and progesterone. And they release a lot of factors that can facilitate that development of the placenta and actually sort of guide how the cells of the placenta can get towards the blood vessels of the endometrium to allow blood flow to the baby, to the placenta. So there are a lot of factors that we have to consider when we actually talk about endometrial receptivity. So there's the fluid factors and the tissue factors as well.
And obviously it is kind of a moving environment as well. As you said, it's not like a heart or a lung that is static. It is constantly moving. So obviously there is a window where this is optimal as well. And you talk about, you know, the toxic inflammatory environment, which you have noticed in your observations and your studies.
Yeah.
So explain a bit about that and what you mean by that toxic inflammatory environment.
Yeah. So we looked in infertile women, and in our study we specifically looked at infertile women who were obese. So they had a BMI of greater than 30, and we looked at the uterine fluid, that fluid within the uterine compartment, and we compared these obese infertile women with lean fertile women. And what we observed is that the obese infertile women had very, very high levels of a family of proteins called advanced glycation end products. Now, advanced glycation end products are a bit complicated, I'm not going to lie, but basically the way that they are formed is that a protein, which is present anywhere in the body, has sugar attached to it, and that forms something called an advanced glycation end product. So basically, sugar sticks to the protein, and then it completely changes the function of that protein. Rather than being performing its normal function within the body, or being relatively in diabetes, and they mediate some of the downstream consequences of diabetes, such as the kidney failure, and they're also involved in cardiovascular disease and also Alzheimer's disease. So they're involved in some pretty complicated disease processes. So our research suggests that these advanced glycation end products may cause a toxic environment within the uterine cavity that may then impact the development or the final development of the embryo, because they're present within that uterine environment, but also may affect the readiness or receptivity of the endometrium to accept that embryo to implant, and also impact the development of the placenta in women who have high levels of these advanced glycation end products. So as I mentioned, our study focused on obesity. However, it's known that women with other disorders, such as polycystic ovarian syndrome or even diabetes, in their normal circulation and their normal blood circulation, have high levels of advanced glycation end products. So it might be that our findings can translate to women who have other health complications as well. And as I've mentioned, advanced glycation end products are formed essentially when sugar sticks to protein. So there are implications for people, not just women, but people who have a high sugar diet. There's some really nice evidence that's come through of the impact of sugar on fertility. So for instance, women who have or who consume what are called sugar sweetened beverages, so your soda in a can, you have 1 can of soda a day, that can increase your risk of fertility, but also development of pregnancy complications. And it just seems crazy that such a small intake, 1 can of soda a day, which a lot of people wouldn't even think twice about, can actually potentially impact your likelihood of becoming pregnancy. So I think that's really, it makes you think about what you're taking in via your diet quite a lot.
And I love that you're showing these effects on a biological and physiological level, because we've had these studies for a while, and obviously we know, you know, things like sodas and soft drinks are really detrimental to fertility health as well as sugars.
Yes.
But you are really showing what it is doing physically to our body. So sugars are one way to get AGEs into our body.
Yeah.
What are some other things that we should be avoiding when we're looking at these advanced glycation end products?
So, I mean, as a consequence of our, what we call a Western diet, there are advanced glycation end products that we can actually take in through dietary sources. So you mentioned sugar. So if we take sugar, we can form an advanced glycation end product within our body. but we can also take them in through highly processed, and as we've transitioned to become personal lives, we are dependent more and more on process. Are also formed via the heating foods, and a lot via processes which use a lot of heat, which use high temperatures. So if we eat processed foods, we can take in advanced glycation end products to our body. Also, the illustration of how to form advanced glycation end products can be really simply illustrated if you cook a steak. So that browning, which occurs on the exterior of meats when we cook them, that is the formation of advanced glycation end products. So that is basically sugars and proteins within the meat being exposed to heat, browning, and forming advanced glycation end products. So if we have a protein-rich diet, where the meats have been cooked via a dry heat, so in a fry pan or on a barbecue or something like that, then we can actually ingest advanced glycation end products via that means as well. Now, unfortunately, we know that smoking has a detrimental impact on fertility. You can also take in advanced glycation end products through cigarette smoke. So our Western diet and also smoking are a variety of ways that we can actually take in advanced glycation end products. But all's not lost, because we can reduce our intake of advanced glycation end products. Obviously, simply via the reduction in consumption of processed foods, but also in the cooking of meat. You can make some very simple changes to the cooking of meat to actually reduce the formation of advanced glycation end products and therefore the intake of advanced glycation end products. So classically in the Mediterranean diet, there is generally a low intake of advanced glycation end products. And the way that they cook meat, or the classic Mediterranean diet, the way that meat is cooked is initially by marinating it in acidic marinades, such as lemon juice. So if you were to marinate your meat in lemon juice or another acidic type marinade before cooking, that actually reduces the formation of advanced glycation end products when you cook that meat by 50%. So by a relatively simple change to how you cook meat, you can significantly reduce the amount of advanced glycation end products in your diet that you are then taking in.
I think a lot of people are quite relieved there, because I think we're just heading into summer, particularly in Melbourne where we are now, or pretty much anywhere in Australia. We've just taken away the barbecue, we've taken away the sodas or the alcohol with the sugar. So
people sad. There are around it.
So it's not all bad news. So things like those, marinating your meats in those acidic, in lemon juices, vinegars and things like that will help to reduce the AGEs in the diet. And then reducing sugar, obviously soft drinks, probably particularly even things like Coca-Cola, I would assume, which would even have...
I don't want to name names.
Oh, no, I shouldn't mention that in there, but probably the black bubbly liquid that, probably has caramelized in there as well, maybe.
Yeah. Well, if you think about it, with a certain brown sugary beverage, you can clean your toilet with it. So I wouldn't really want to drink it, because I don't want to imagine what it does to your insides. But if you think about sugary beverages, I think we should also consider juices, because people view juice as being very, very healthy. But by breaking the juices down, by breaking the fruit down into just the juice, you're actually removing a lot of the benefits, a lot of the fiber that you're taking in with the fruit. So I'm not saying cut out fruit. I'm not saying that for a second. Absolutely consume fruit and vegetables, but consume them as a fruit, not just as a mushed up juice where you've taken out a lot of the good bits.
Yeah, that's a big thing. Often a misconception that I often have to let patients know, because they do have the big boost juices and things like that are very popular, but you are removing all that fibrous portion. And obviously when we're talking about these AGEs, it is the sugar component largely that has the detrimental effect. And it's obviously the blood sugar. That's why you're noticing it more in obese women and pre-diabetics. So I assume insulin resistance, which is becoming more prevalent in PCOS, would be more likely to producing these AGEs?
Yes, so we know that in women with polycystic ovarian syndrome, they do generally have higher levels of advanced glycation end products. So that's, it's all mixed up in the insulin resistance and the formation of these via high blood sugar levels. So that's one thing to really keep an eye on, because while people might not have full-blown polycystic ovarian syndrome, they might not have full-blown diabetes, you can think that you're relatively healthy, but actually still have some aspects of these metabolic complications. So I think it really is important when you're thinking about fertility, when you're thinking about preconception, to really have a thorough health checkup. Some people might not realize that they are on the cusp of diabetes because it's a very underdiagnosed disease. So go to your GP, have the thorough health checkups before you actually think about conceiving. And, I think this is something we're going to come on to, but it's that thinking about conceiving, because there's been a lot of studies which have looked at lifestyle and dietary interventions during pregnancy. So during the first or very early second trimester of pregnancy, and the dietary and lifestyle interventions during pregnancy haven't actually shown that many benefits in terms of either the mother's outcome or the baby's outcome. And I think that's probably because, as I mentioned, those critical events that are occurring before the embryo implants, so those programming events within the uterine cavity, and also those events around the time of implantation, are actually when the complications for either the mother or the baby are being programmed. So if you intervene later in pregnancy, you've missed that critical window when we can actually benefit the outcome of fertility or pregnancy. So for people who are wanting to become pregnant, start before the beginning. So before the beginning is the concept. Think about, all right, I'm going to change X, Y, Z. And you might want to change, aspect X, which might be your diet, 3 months out. You might want to change exercise 2 months out. And I think it's about doing things in a stepwise manner as well, not putting the burden of, okay, I'm going to stop drinking alcohol, and I'm going to change my diet, and I'm going to increase my exercise all on one day. Because if you try and do that, you'll just feel overwhelmed. But make those changes gradually, make those changes well before you decide that you want to become pregnant. And I think that is the way to try and improve your fertility, improve your chances of actually achieving that healthy pregnancy.
I love that you're doing everything that I love to say and let people know, and you're showing it at a biological level, because I always say, look, the development of the egg, when we're talking about egg health, does take 90 days. So Exactly. It is during those 90 days that you can influence the health of that egg. I just did a Talk in Fertility series recently on your daily routine and those small little changes. It's not about these big detoxes that you plan to do or these big things that you can't stick with and you won't be able to achieve. It's those little things and the little changes that you can make prior to pregnancy. I love the saying, when you're just a twinkle in your father's eye. I think that's when you start being a parent. That's when you start becoming a mother. That's when you're nurturing the DNA that is going to become your future child, and you're nurturing the first home as well, as we're saying, that uterine environment. Yeah. And I guess the positive thing on that note, I know we have been a bit negative about the foods that we're not allowed to eat, but on a positive note, the uterus, as we're saying, isn't a static organ. It does regenerate relatively frequently. So I would assume that these changes would be able to be made relatively quickly. Within 1 to 2 months, you would be able to notice these changes.
Exactly, because with the endometrium, again, we come back to those static organs. It's not a heart, it's not a liver. It's an organ which is completely regenerated every single month, or roughly a month, however long your menstrual cycle is. So at menstruation, that tissue into which the embryo is going to implant is completely shed. So you're given a unique opportunity to start again, to regenerate that tissue, to change the environment within that tissue. So when we think about fertility, a lot of people are focused on eggs. Now, eggs, yes, you do have a 90-day cycle, but also eggs, you're born with all the eggs that you're ever going to have.
Yeah.
So born, they're all sitting there. They could potentially be developed and ready to go. To completely change your thinking when you think about the endometrium. We can intervene potentially every single month to try and improve that environment. So, for people who've undergone IVF and haven't necessarily been successful with transfer of an embryo in an IVF cycle, then I think it's very easy to become hung up on that, the fact that you haven't achieved pregnancy in that cycle. But I think you could, for people who haven't achieved that success, take a step back and say, well, okay, now think about that unique opportunity, that unique time to change things that occurs every single month. So again, it's about taking those small steps which can build up into a big effect. And when we think about the endometrium, it's part of those small steps to make a change. We can change it every month. So don't beat yourself up about, oh, well, it hasn't happened this month, it hasn't happened this month. Every month is a new opportunity.
Yeah, I think it's a wonderful thing. So, never too late to start. So if you have been eating a poor diet and you have been eating some of these things in your diet quite frequently, which I just had a few emails before I started actually and said, I have a really high sugar diet. Do I need to listen? So, but don't beat yourself up. There are things you can change now and quickly make improvements.
Yeah. And I think, the emphasis is, again, like you said, don't beat yourself up.
Yeah.
You can make changes. You can improve your health. You can improve your diet. And just make it gradually. Don't cut sugar out completely 100% immediately if it's going to make you cry and be sad. Cut it down step by step by step. We all need a little bit of pleasure in life. I'm not going to deny that I like a piece of chocolate every now and again. I know for a fact that obviously chocolate is high in sugar, but having it a little treat, having it once a month or something like that, as okay, it's pre-period time now. I need a piece of chocolate to cheer myself up. Do it every now and again, but make it a treat. Don't make it I need a piece of chocolate at 3 o'clock every single afternoon.
Yeah. Yeah, that's the sort of thing you can change. Yeah. I guess if there's people listening who perhaps are going through what you mentioned and failed cycle and failed IVF implantation, is there any way to know? I mean, it's not like our skin and we can see pimples or we can see, the inflammatory toxic environment within the uterus. Is there anything we should be looking out for, or how do we know our uterus is healthy?
That's a really difficult question to answer, and it's something that we're actually working on quite a lot in our laboratory. So we're trying to develop a test that will tell us if the endometrium is ready or not ready. And so we have a number of ways of doing that. One way is by sampling that uterine fluid, so that sort of unique environment within the endometrium, within the uterine cavity, and we can perform something called a uterine lavage, which is infusion of salt water, basically sterile saline, into the uterine cavity to wash out that cavity. And we can actually test for inflammatory factors, such as advanced glycation end products, within that local uterine environment. Now, that is going to give you a snapshot of just that cycle. So if you're not transferring an embryo in that cycle, that can obviously be a problem. So we're also trying to develop a blood test to give us an indication of endometrial receptivity and whether the endometrium is going to be ready to receive an embryo, specifically focused on IVF cycles, just because it's difficult to get women in, just come in for blood test after blood test after blood test. Whereas if you're undergoing an IVF cycle, you're actually presenting to the clinic quite frequently anyway. So we are working hard to try and develop tests to tell us whether our endometrium is ready to receive that embryo or not.
Oh, that's great that there may be a blood test. It is quite a systemic thing. Obviously, we're focusing on the uterus today too, but we're not just a uterus wanting to get pregnant. We're a whole body. So it's about optimizing, and the changes that we're making to improve uterine health. We're obviously improving our overall health as well. And I think it's a fundamental thing that we're really going back to. And, even in the Hippocratic era, let food be thy medicine and medicine be thy food. That's what we were meant to be doing. And I think we're just really getting back to that and getting in touch with the reasons why that still rings so true.
Yeah. And I think, again, as I said earlier, it's kind of a consequence of modern life. We're all so ridiculously busy these days. And when you get home after a hard day of work and if you've got children at home, they just want something to eat right now. It's very convenient to grab something just, off the shelf of the supermarket. And it might be highly processed, or it might be a jar of sauce or something like that. You just throw it on some pasta. If you flip those over, there's a lot of sugar and a lot of preservatives and a lot of not great stuff in those pre-prepared meals and things like that. So yeah, I think it's just a consequence of modern life that we have to, like you said, reevaluate what we're putting into ourselves, because it's not an easy route. You know, there are medications we can take to lower blood sugar, to, you know, transform a disease, but we can also intervene with diet. It'll just take longer to get there, but it is a more holistic way of actually changing our bodies, changing our life, potentially changing our fertility. So I'm sort of stuck between the two, being a research scientist. I want to develop pharmacological or drug therapies as well to try and sort of, you know, benefit fertility. But I also want to take a more holistic view and try and determine how we can change the health of the person to actually impact their fertility. And I know that today we've, you know, talked a lot about the women. Don't forget the men.
Yeah. Yep. Absolutely.
In a couple, the man and the woman, or both women if it's a same-sex couple who are trying to get pregnant, or both men if it's a same-sex couple again, both aspects of the couple will, you know, generally have the same diet. So don't just focus on one partner, focus on both aspects of the couple to try and improve the fertility.
And it does make a huge difference. I did a previous podcast with Associate Professor Adam Watkins from the UK about his research into male preconception health and the fact that the sperm isn't just a DNA carrier, it isn't just a DNA vehicle. It actually does influence the development of the embryo, the development of the placenta, and the I guess, the likelihood that it will go on to be a successful pregnancy. So men don't get off the hook with the barbecue and the sugar as well.
No. Although, you know, if you think about it, you've got this egg and you've got the sperm coming in. Like you say, it's not just a DNA carrier, and the way that technologies to analyze the sperm and the seminal fluid are evolving, are, you know, becoming more and more sophisticated. So we're understanding more about that, and it's also about the seminal fluid. So there's been a lot of beautiful work performed by the University of Adelaide that have shown that seminal fluid can actually affect the function of the cells of the endometrium. So if the quality of that seminal fluid, not just the sperm, but the fluid itself, is altered, that can potentially affect the quality of the endometrium, and therefore potentially, you know, the implantation likelihood or the pregnancy likelihood within that cycle. So no, men, you're not getting off. You can't have your chocolate and beer as well. You probably make changes too.
And it does make sense if we optimize everything, you know, the sperm health, the egg health, and the uterine health, not just focus on one aspect, and obviously our whole health as a system, we're going to not only achieve a more successful pregnancy and conception, but it can, as you said, influence the long-term health of the child, who is very much influenced by those early stages of development and what DNA is passed on to them to develop.
Yeah, I mean, there's been a lot of studies now looking at preconception, not in humans, admittedly, per se, because they're quite difficult studies to do, but in laboratory models, there's been a lot of research looking at maternal, generally obesity and diet, and the outcomes for her offspring in terms of their development and their incidence of non-communicable diseases. And by that, I mean cardiovascular disease, obesity, diabetes, and also sort of development and cognition, so the way the brain functions. And that can potentially all be influenced by the mother before, you know, she conceives. So I think it really is important to emphasize that we should be focusing on, again, I'm banging on about preconception, but
I love it.
look at your sort of, you know, look at yourself in terms of, if I make changes 3 to 6 months, before I want to become pregnant, and maintain those changes during pregnancy, that means that for their entire life, whether that be 60, 90, 120 years, however long our children will live in the next generation.
Probably longer than us, yeah.
Longer with us. You know, changes for a relatively short period of time are going to benefit our children. I think everybody wants the best for their children going forward. That's what, you know, all parents strive for. They want to give their children the best in life. So give them the best start before they've even started, before they're a twinkle in their father's eye.
Absolutely. And as I say on my website, being the best mum starts well before birth. And it's, really well before we even conceive that we
Yeah.
really start being the best parent that we can to our children. So although, as you said, these dietary changes can be hard, that we, admittedly, they are harder than taking a pill.
Yeah.
But if we can make these changes now, it is such a short time. It really is a blip in the whole scheme of things, even if we're talking a 3 to 6 month period. When we're talking about the lifelong health of your future child, this really is a small sacrifice to make. And it's really the understanding and the awareness and prioritizing these things, because convenience, taste, these things all influence our food choices to a great extent, probably more so than their health benefits. But if we can understand the implications that our dietary sources are having, I think it's easier to make the changes because you know what impact it's having, and the fact that it is having a significant impact. I deal with a lot of patients who have been trying to conceive and are referred from fertility clinics who've been trying at the fertility clinic for 5 years or so. So I think don't lose hope, because as you said, we can make positive changes very quickly. You have a new opportunity to optimize that uterine lining every month, which is really exciting. So yeah,
don't lose hope. I mean, like you said, like we both said, every month you have a unique opportunity. So just sort of think, make these changes, make the changes in the new month. And I'm not saying that by changing your diet we can completely cancel out the need for something like in vitro fertilization, because we know that there can be problems with the sperm, problems with the egg. But if we undertake in vitro fertilization to get over those problems and we can produce an embryo, then the final barrier, I guess, is the uterine environment and the endometrium. So produce those embryos via IVF if that's what is absolutely needed because of other problems, but then optimize that local uterine environment, that local endometrial tissue, to make the best home for that embryo that's being produced, the best home possible.
And I think that's a great thing that women can be empowered to do, because IVF can feel like the control is taken away from you in some respects. Because
you're pincushion.
You do become a pincushion, and you're very much guided by what the specialist is doing, and things are taking you out of you here and there. So I think knowing that you can play a big role in the success of that and helping to optimize that environment that embryo is being implanted back into really is a heartening thing for women to be able to do. So, I mean, we talked a lot about AGEs, the sugar. If you could just sum up what your recommendations would be for people listening who are thinking, oh, this could be me, I'd really like to optimize my fertility health. What would your top tips be for them?
Look, I think before you do anything, have a chat with either a fertility specialist or have a chat with your GP and get a general health checkup. Because you might be having problems conceiving, but it might not be diet. It might be something like your thyroid is acting up or something like that. So get a general health checkup. Get a checkup of your blood sugars. Check out if you're on the the pre-diabetes cusp and things like that. So go to your GP, get a health checkup. Check that nothing needs to be balanced out. Change your diet. Reduce the sugar. There's a Monash nutrition project called Not Scared of Sugar. I am a little bit scared of sugar, I will confess, because I think we are understanding now how bad it can be for our bodies. So cut out that sugar. It was a really interesting statistic I read the other day that in the 1800s, it took a week and a half to eat the amount of sugar that in Western societies we now eat within a day. So our consumption is just changed radically over time, and I think that's they used to have a lot of babies back in the day. So take now what you will. So reduce the sugar in your diet, and I think also relax. So we've become so focused on an outcome, become so focused on trying to conceive, and it took me personally a long time to conceive. We can become so focused on that goal that we forget to sort of have fun. Making babies should be fun. I mean, having sex should be fun. It's an important part of a relationship. So just relax. You might become pregnant naturally, very naturally, if you just take that pressure off yourself and just remove those stresses from your life of being totally focused on trying to conceive. I know that's a difficult thing to do, having been through, like I said, a prolonged time to conception myself, but make it fun, revisit who you are as a couple rather than just being an organ, rather than being an ovary and a sperm and a uterus. You're two people who are trying to make a baby.
I think that's such important advice, and it is difficult. I had a similar journey myself, and it is difficult when you're in that zone and you are desperately trying to have a baby. But, you know, the studies are now showing that women particularly, unfortunately, are affected by stress.
Yeah.
So if we can take that stress off, and we've got some tips at TashaJennings.com.au on my Talking Fertility. I just spoke last week about the power of the breath and just breathing and mindfulness and those sort of activities, because every cell in our body is listening to our thoughts, and it listens to our unconscious thoughts more than we do. So it's really important to change your mindset for those things as well. So, yeah. Great advice there today, and thank you so much for being with us, and thank you for converting over to the side of fertility and making all these amazing discoveries that I'm thrilled to be sharing with everyone today, because I think it really will make a difference to outcomes, and I'm really looking forward to seeing your research. I'll be following that close, and I look forward to hearing about your outcomes.
Great, thank you very much. I mean, I'm very much focused on getting the best pregnancy possible for everybody, and I think that is, you know, it's critical that is underpinned by the basic research and the basic understanding of how your tissues are functioning. So what we do in the lab, it might seem to a lot of people like we're just fiddling with cells. Yes, I do fiddle with cells, I'm not gonna lie, but it's those basic discoveries that can actually work their way through to big translations in outcomes for couples who are struggling with infertility. So we're working hard, really, really hard, to try and benefit people who are struggling with infertility.
That's such an amazing goal to have, and I will definitely be following your research and what you're doing, because it really is making a huge impact, and particularly now these human trials that you are now going to embark on are going to make a huge difference. So congratulations on everything you've achieved till now, and all the best success in the future. And thank you so much. I know you have a very busy schedule for sharing your time today to help other women who may be struggling.
Very, very, very happy to do so. Thank you very much for the invitation.
Excellent. Well, thanks everyone for joining us. I really hope you've enjoyed our discussion today. I know I personally certainly have. Gemma's research is absolutely amazing, and as I said, I will be following it and letting you know the updates so that we can keep you posted on that. I know many of you listening will be wanting to know more information about AGEs and how you can optimise uterine health. So I will pop some information and a checklist for you at TashaJennings.com.au. I might put that at TashaJennings.com.au/uterine health checklist, so that you can get that information and start optimizing your uterine health today to improve your chances of conceiving and carrying your healthy baby. So thanks again to Gemma for joining us, and I look forward to seeing you all next time.